Hey everyone! So, if the thought of charting, documentation, and all those medical records makes your head spin a little, you are in exactly the right place. I know it can feel like a ton of information, but today we're going to make it all click. Seriously, by the end of this, you'll have a super clear framework to not only crush your exams, but to walk onto that clinical floor with some real confidence. Let's do this.
So here's our game plan. First, we're going to start with the why. Like, what is the huge problem that good documentation actually solves? Then we'll dive into the two big ideas, the philosophies, that shape pretty much all medical records. After that, we'll get into 3 specific charting formats you absolutely have to know. And we'll wrap it up with the modern electronic systems and, honestly, the most important part, where you fit into this whole picture.
All right, let's kick things off with the most fundamental question. Why do we even do this? Look, it's not just about paperwork or, checking boxes. It's about telling the complete, ongoing story of a patient's health. And when that story gets broken up or disconnected, well, that's when the real problems start. And this right here, this is the villain of our story, fragmented care. This is what happens when all the different providers, the doctor, the nurse, the physical therapist, don't have a clear shared picture of the patient. If they're all basically writing in their own separate notebooks, the patient's story gets shattered into a million pieces. And this isn't just messy, it leads to huge issues like missed allergies, medication errors. It can lead to genuinely bad outcomes for the patient. A perfect example of a system that can cause this fragmentation is the old-school traditional source-oriented record. Just imagine a giant binder with different tabs, right? One for the nurse's notes, one for the doctor's orders, another one for lab results. It's all organized by the source of the info. But to get the full picture of what's happening with the patient, you literally have to flip back and forth trying to piece it all together yourself. It's a recipe for that fragmented care we were just talking about. Okay, so if organizing the chart by who wrote the note was causing all these problems, what was the solution? Well, a whole new philosophy came along that completely flipped the script. Instead of organizing the chart around the provider, the big idea was to organize it around the patient and their problems. Let's take a look at how this one simple change makes all the difference.
And wow, the difference is like night and day. On the left, you've got the source-oriented method, all siloed by department, kind of like separate filing cabinets that don't talk to each other. But over on the right, the problem-oriented approach is a total game changer. With this, everyone, the entire healthcare team, is documenting around a central list of the patient's actual problems. It creates one cohesive story, not just a bunch of separate chapters.
So this approach is officially called the Problem-Oriented Medical Record, or POMR for short. It's got 4 key parts that build on each other in a really logical way. First, you gather all the data, the whole database. Second, you create a master list of the patient's problems. Third, you make a specific plan for each of those problems. And fourth, and this is key, everyone uses a standardized format, like the famous SOAP note, to track progress. Everybody is literally on the same page.
So we've got the big picture philosophy down. Now let's get a little more tactical and look at the actual charting formats you are going to see and use every single day. Think of these as the different languages of clinical documentation.
All right, you might want to screenshot this slide because SOAP is a classic for a reason. It's just such a structured way to think through a problem. S is for subjective, that's what the patient tells you. O is for objective, that's what you can observe and measure. A is your assessment, basically what you think is going on based on the S and the O. And finally, P is your plan. What are you going to do about it? This structure is brilliant because it makes sure you cover all your bases.
Next up, we've got the PIE model. And this one is really cool because it was designed by nurses for nurses. It cuts right to the chase and perfectly mirrors the nursing process. You identify the problem, you document your intervention, and then you write your evaluation of how well it worked. It's super streamlined, and you'll often see it used with flow sheets for really quick and clear documentation.
And our third key format is focus charting, which uses the DAR structure. This one is fantastic for documenting a specific concern or event, like a sudden change in your patient's condition. You state the data, that's both what the patient says and what you see, the action you took, and, crucially, the patient's response to that action. Did the pain med work? DAR tells that specific story clearly and concisely.
Okay, let's jump to the present day. Paper charts are pretty rare now, and you'll almost certainly be working with electronic systems. And these bring incredible efficiency, but they also have their own unique set of challenges.
First, a quick word on something called charting by exception, or CBE. The idea is simple. You only document what's abnormal.
So if a patient's entire assessment is normal, you might just check a single box. It's fast for sure, but you have to be careful. The big pitfall here is that legally it assumes that everything you didn't chart was normal and that all the standard care was given.
And this brings us to modern electronic health records, or EHRs. These are really designed to solve that original problem of fragmented care once and for all. I mean, think about it. The entire team gets real-time access to the chart. The system itself can flag things like potential drug interactions or allergies. Care becomes so much more coordinated. And maybe best of all, no more trying to figure out a doctor's handwriting.
But there's a pretty big vulnerability. In this super high-tech world, what happens when the power goes out, or the whole system just crashes?
And this is a really critical point for you to remember. EHR downtime is a real thing, and it can be super disruptive. Suddenly, all those amazing safety features and instant communication tools, they're just gone. But your job doesn't stop, right? So you have to know your facility's downtime procedures. And yeah, that often means going back to old-school paper charting until the system is back up and running. So this brings us to our final and, honestly, our most important section. We've talked about all these different philosophies and formats and technologies, but what's the one constant that ties it all together?
It's you, right? Whether it's a source-oriented paper chart from 30 years ago or a state-of-the-art EHR, the system is just a tool. You, the nurse, are the storyteller. You are the one person who is responsible for making sure that documentation is accurate, it's complete, and it clearly communicates the patient's story. That fundamental responsibility, it never ever changes.
So I'll just leave you with this question to think about as you start your careers. It's not about just filling in the boxes of whatever system you happen to be using. It's about really taking ownership of that patient narrative. How will you make sure your notes paint a clear, complete, and compassionate picture of the human being that's in your care?
And that's a wrap on our deep dive into documentation. Hey, if this helped you connect the dots, made things a little clearer, please give this a like, maybe share it with a classmate who's also struggling with this stuff, and definitely subscribe for more nursing school explainers. We're here to help you get through it all.
And hey, if you're serious about acing those exams,